This is Pune, and she loves her bubble tea, but she has diabetes, so she takes metformin.
So let's talk about metformin, which is not only common medication but also first line of drug for type 2 diabetes mellitus. So moving on, there are several brands that contain metformin as an sole active ingredient. One of the most common brand is called the glucophage, which is an oral diabetic medicine that helps control the blood sugar level in the type 2 diabetes mellitus. It usually comes in the immediate release or the extended release version. It's often used together with the lifestyle modifications such as diet, exercise to improve the blood glucose control. In some conditions, glucophage should not be given, for example, like in patients with a severe kidney disease, metabolic acidosis, or the diabetic ketoacidosis, because metformin can worsen this condition. Like other medications, glucophage has some possible side effects, such as patients might experience low blood sugar, nausea, upset stomach, or the diarrhea, but don't need to be worried because these symptoms are mild and will improve over time. So let's talk about metformin. Metformin is an FDA-approved anti-diabetic medication, and it's one of the most commonly used drugs for patients with the type 2 diabetes. It's considered the cornerstone of the treatment because it helps control the blood sugar level very effectively. The main role of the metformin is to keep the blood glucose level within normal range by reducing the glucose production in the liver and improving the body's sensitivity to the insulin. Now, who should take metformin? It's mainly prescribed for people with the type 2 diabetes, but it can also be used for patients with a gestational diabetes. Additionally, individuals who are at high risk, such as obese people, may sometimes be given metformin as a preventive measure.
Metformin works by improving glucose tolerance by lowering basal and postprandial blood glucose. It decreases hepatic glucose production and reduces glucose absorption from the intestine. It enhances insulin sensitivity and increases glucose uptake and utilization. It does not stimulate insulin release, thereby avoiding hypersecretion, and typically does not cause hypoglycemia. It's transported into hepatocytes via the organic cation transporter 1, and metformin accumulates in the mitochondrial matrix. The primary molecular target is the mitochondrial respiratory chain complex in hepatic cells. Metformin indirectly activates AMP activated protein kinase by increasing AMP to ATP ratio. Metformin activates AMPK, which tells the liver to stop making excess glucose. This reduces activity of enzymes involved in liver glucose production. It improves insulin signaling so that cells can take in glucose more efficiently. This leads to reduced mitochondrial activity in hepatic cells, therefore reducing glucose output. The main physiological effects of metformin include lowered fasting glucose, which happens by suppressing gluconeogenesis. Metformin significantly reduces fasting blood glucose levels. It also reduces post-meal glucose, which enhances peripheral glucose uptake, therefore leading to lower postprandial glucose excursions. There is also a metabolic shift, in which cells shift from storage to catabolism. Fat synthesis is inhibited and fatty acid oxidation increases. There's also glycemic control, where overall HbA1c reduces, thereby improving long-term glycemic control with lower risks of developing hypoglycemia. And the last physiological effect is weight on an insulin. Metformin may cause modest weight loss and fasting insulin levels to typically fall.
Pharmacokinetics describes what the body does to the drug in terms of absorption, distribution, metabolism, and excretion. In terms of absorption, Metformin uses transporter-mediated uptake as a mode of absorption with help of organic cation transporters and plasma membrane monoamine transporters, also known as PMAT. It has a bioavailability of around 50-60% per 500 mg tablet. In terms of distribution, it is distributed to the liver, the kidneys, and the intestines, and a low percentage binds to the plasma proteins in the blood. In terms of metabolism, metformin is not metabolized in the body. However, when it comes to excretion, it is transported from the blood to the urine through a process called active tubular secretion. It has a half-life of around 5 hours. So active tubular secretion takes place in the kidney, which makes good kidney function very important. This is because it prevents accumulation of metformin in the body.
Let's talk about the side effects of metformin. Starting off with the more common side effects. You may experience nausea, vomiting, diarrhea, stomach discomfort, loss of appetite, or even metallic taste in your mouth. However, this side effect might reduce once your body gets used to metformin. Moving on to the more serious side effects. It's rare but important. Lactic acidosis. It can occur when there's too much buildup of metformin in your body. Long-term use of metformin can also cause a deficiency in vitamin B12, which can lead to anemia. Hypoglycemia can also occur, but only usually when paired with a poor diet, strenuous exercise, excessive alcohol intake, or paired with other diabetic medication. Before taking metformin, here are some important warning and precautions to know. First, who should not use metformin? People with allergies to metformin or similar formulations like Fortamet or Glumeza should avoid it. Next, patient with kidney problems. If your kidney isn't functioning properly, your body cannot clear up metformin efficiently. Therefore, the drug builds up in your body and then it will lead to lactic acidosis, which is a serious side effect. Another group of patients that should avoid are those with metabolic acidosis, especially diabetic ketoacidosis. Since their blood is already acidic, metformin will only worsen the condition. Moving on to the right side of the slide, precautions. To reduce stomach upset, which is common, metformin should be taken with meals or after meals. Extended release tablets should not be crushed or chewed, otherwise the medicine will be absorbed too fast and won't work the way it's supposed to. For liquid forms of metformin, patients should use the proper measuring device to prevent incorrect dosing. One interesting precaution is that metformin can trigger ovulation. So for a woman that has not had menopause, this can increase chances of pregnancy. And of course, like any other medication, it should be kept out of children's reach.
Now, let's look at some interesting facts about metformin. It is much more than just a glucose lowering agent. First, the history. Metformin has been around for a long time. It was first reported for use in diabetes back in 1957 by the French physician Jean Stern. Second, it works in the gut. We now know metformin actually modifies how your intestines handle glucose and even changes your gut microbiome. Third, it's versatile. It is commonly used for PCOS, polycystic ovary syndrome, to help improve menstrual cycles, fertility, and high blood sugar. Fourth, it goes beyond sugar. It has pleiotropic effects, meaning it helps with other things like fat metabolism, obesity, and even fatty liver disease. Finally, the anti-aging potential. Research suggests metformin might help slow aging and lower the risk of diseases like Alzheimer's and cancer. Though scientists are still studying exactly how this works. In short, it is a classic drug with some very modern applications.